AI and AMR. One may ask, what is this AI and AMR? AI, all of us know, it is artificial intelligence. The AMR, we would have studied in intellectual property rights something like EMR, like exclusive marketing right, electronic management right system, something like that. This is in biology. It is called antimicrobial resistance, AMR. Now, why we need to study this? In fact, there is one more terminology called superbug. Sometimes you may be asked a question, what is a superbug? People may think that it is a computer virus associated with AI or other things, something like that. Actually, it is not. A superbug is a bug which can successfully resist any amount of antibiotics. And instead of dying, it will keep mutating. Thereby, it will challenge all the antibiotics. So, this is the biggest challenge or biggest threat that the humanity is facing today. Now, WHO prescribes this as something like X antibiotics. X means it is not a named disease, but they believe such a disease will come sooner rather than later, and we will be remediless. We will be facing remediless situation. The entire world has just seen the pandemic of COVID. We don't have a prescribed medicine. Whenever we don't have a prescribed medicine, people simply resort to antibiotics just to boost the immunity, overall immunity. Thereby, we believe you can defeat the concerned virus. Even when HIV has come, there is something called ARV, antiretroviral. This is viral, so it can be the antimicrobes can be any form of things. Like it can be antibiotics to combat the virus, antibacteria, antifungi, something like that. But if it is able to kill the concerned virus or bacteria, then the antibiotics is successful. But over a period of time, like to put it simple example, these microbes develop resistance to the antibiotics. They keep adapting and resilient, successfully survives or outperforms this, overcomes this. What is that obstacle or effect of this antibiotics? Say example, when you use the mosquito, what is that? We are using several mosquito controlling mechanism, like several liquids like good night, many things. In the initial days, we may feel it is able to combat the mosquito. But over a period of time, the mosquito learns, behaves, adapts whatever anti-mosquito things which are using. The same way. So you have to switch over to some other one. But how long you will do this? So this is the scenario, and so in the entire body becomes useless. Actually, the antibiotics was a big breakthrough during the Second World War, when large number of soldiers have been wounded. They don't know what to do. At that point of time, this antibiotics started helping in curing a large number of wounded soldiers. This is how the antibiotics have started. But today, for any surgery or any disease, any pathogens, if the doctors don't have any clue, they simply prescribe general antibiotics, and that too without any scientific basis, in the sense there is no exact quantification. They don't have any targeted delivery system. They simply put you generally as a precautionary principle, whether you may face the resistance or not, whether you will face the problem or not, in advance, in anticipation, as a thumb rule, they prescribe the antibiotics overall, irrespective of the factor whether you need that antibiotics or not. This is a very, very unethical practice, largely adopted in India for the two reasons. One, India happens to be a so called well pharmacy and generic. If it is patented, the medicine will be very costly. So, therefore, you will be using it very sparingly rather than frequently. Since it is available at a cheaper cost, they do it. First thing. Second thing, there is a huge lobby from this generic medicine pharma people that they incentivize the doctors to use it through unethical allurements. This is very unfortunate. Third thing, ICMR has to tighten this usage of antibiotics. One cannot generally prescribe antibiotics without making scientific impact assessment what it is going to do, that whether it is needed or not. Without doing the study, they simply prescribe antibiotics for anything. We cannot blame the physicians or doctors alone. Sometimes the patients have a tendency to go and get the antibiotics across the table, across the counter in the medical shops, even without the prescription of the doctors, and they simply started consuming without any medical advice. This is another dangerous problem which is prevailing in India. Though many of them could have been put in the scheduled categories in the Drugs and Cosmetics Act, but still, don't nobody is following this law, right from the pharmacy people, doctors, patients, everyone. And finally, when the problem comes, they start blaming one another. So this is the problem. So WHO says that people have to be very, very cautious when prescribing antibiotics. Unless it is extraordinarily necessary, one cannot prescribe it. That is what WHO stand. That is what ethical stand also. I think ICMR has to do that. So now you may ask me why I have spoken about AI in the beginning. Now AI has made dramatic breakthrough in many fields, including health. Now people believe that AI can identify and detect the superbugs and try to study those things and find to a necessary remedy to kill those superbugs which is keep on mutating. Mutation is nothing but it is changing the format and manifestation. In the olden days, we would have studied that when there is a war between God and Shura or Ashura, whatever we call it, the Asuras are keep changing their format and God will try to identify and destroy them. Something like that today. The viruses or bacteria, whatever we call it, the microbes, keep mutating. Say it's not mere variant. Say in the COVID also we'd have seen several variants, but it's not mere variant. Complete change of format. So complete new format, new avatar, one may call it. So these existing antibiotics becomes helpless to deal with the changed or mutated form of form of microbes is concerned. So there we believe the AI can be very, very effective not only in identifying but in treating and studying the characters of mutation, all these things. There is one theory called gain of function theory. This is very much prevalent in biologics. The gain of function theory is that they will artificially culture these sort of microbes in the lab, and they will study this when it is undergoing mutations, how it can be combated, all these things. Even there is one set of story which tells us that such a lab was made available in China, which was funded by US because US bans these sort of gain of function theory based scientific research, because you are artificially developing new viruses and try to see how it is creating impact in the controlled environment. If at all it comes into the natural environment, we find remedies to overcome them. So accidentally, people believe accidentally That sort of microbe have escaped from the lab in China, that is Wuhan, and then it has caused all this COVID pandemic. But there are many stories, and we don't have authenticated complete proof of any of the story, because China is by and large evading to cooperate with WHO and other international organization. Therefore, we couldn't come to a appropriate conclusion what could have caused the pandemic is concerned. Whether has come from the zoonotic disease, something like that, is it a natural virus, or it is artificially created one, something like that. In fact, to regulate all these things, we have something like chemical weapon convention. We have something like biological convention on biological weapons, because these sort of viruses, microbes can be used as a weapon, as a biological weapon. So there is one international convention to regulate all those things in using in the warfare is concerned. But in treatment, scientific treatment or health field, we need to go a long way in developing such a convention is concerned. But however, WHO is making their best effort. So currently, ICMR is also undertaking lot of studies in this. We believe in the future ICMR will come out with a stricter regulation in regulating the behaviors of the doctors as well as patients in prescribing and or in administering antibiotics is concerned. So superbug, one has to remember, AI is very helpful in many ways, not only in identifying the superbugs, but also in drug delivery system, effective delivery system. Because today we administer antibiotics which runs through the entire body instead of delivering it to the affected parts minutely. So that role will be done by AI. Apart from AI, will also contribute effectively in drug discovery, because discovering a new drug is a huge phenomenon. It's not a simple task. It's a daunting task. A lot of screening has to be done, lot of testing, a lot of trials have to be done. It's a costlier affair. That is why we give them patents and other data exclusivity and other form of IP, so as to incentivize them. But of course, it is proved to be detrimental to the developing countries like India and other countries. So we find many cooperations, international cooperation mechanism within the trips and beyond trips, sometimes which is found out in WHO and other UN based mechanisms. So we believe AI will be very useful in dealing with that. In India, there is one organization is investing or concentrating in this sort of research. That organization is coming under CISR. It is based in Hyderabad, called Center for Cellular and Molecular Biology, which is conducting research in these sort of antimicrobial resistance or AMR, and how to use AI. So people have to develop synergy between the computational experts or AI expert and the pharmacist, doctors, all these things. It's a cross-cutting initiatives or cross-sectoral initiative. Different domain experts have come together, try to find out an amicable solution. Thereby, we can create a win-win situation, and thereby we can create an inclusive, sound, sustainable health ecosystem across the globe. Thank you.